Hi, this is Curtis Alexander. In today's video, we're going to be talking about Entyvio or vedolizumab. Entyvio is actually a medication that I just became aware of. It's fairly new, and it's a new drug used to treat ulcerative colitis or Crohn's disease, which affects a lot of people. Now, the interesting thing about Entyvio is that as far as how it works in your body, it's going to be blocking a compound. I'm not even going to give you the compound name. It's very technical, but essentially what it's involved in is, again, inflammation in the body, and particularly the digestive tract, which causes these issues for these folks. So the bottom line is what it does is it's going to decrease inflammation. Now, how Entyvio is given, and this, it can be a downside, it can be an upside. It depends on the kind of person you are. But rather than a sub-Q injection that you can do at home, you are going to have to go into the doctor's office, get an IV infusion. The infusion itself takes about 30 minutes, and you're going to have to tack on time for them to get you set up at pre-meds, that kind of stuff. So it is going to be somewhat inconvenient on the dosing schedule for some people. Other people it won't be. They're okay with going into the office. You will receive an infusion on day 0 when you start, 2 weeks after that, and then at week 6. And then once you get to week 6, you're going to do it every 2 months. So it's, once you get your loading dose up, the frequency becomes very manageable, only every 2 months. Now I want to point out the 14-week mark. With Entyvio, what's going to happen is if you get the infusion, and you're going along and you get to 14 weeks out and it's not working yet, they're going to pull you off it, because at that point, if it's not working at 14 weeks, it's not going to work for you. So the 14-week mark, you won't have to take it for a year. You'll know within the first few months. So now drug interactions. Because it's being given IV, we're able to avoid some of the issues we have. But what we're not able to avoid is any other drugs that may be decreasing your immune system. An example would be some of the TNF blockers, like if you have arthritis or stuff like that. Tacrolimus for suppressing the immune system. So anything that you might be taking that lowers your immune system, you're going to get that compounded with Entyvio. You're going to run into immune system issues more likely, because while it doesn't sound like it addresses the immune system, inflammation, I mention this in a lot of these videos for these newer classes of drugs, inflammation is part of the immune system's response. It just gets out of whack sometimes. So we're trying to address that with these drugs. But when you do that, you can run into immune system issues. Okay, how about side effects? Again, with any of these newer classes of drugs that are injectable, we run into the issue about AB development or antibody development. Your body sees the drug and can develop antibodies and actually make it less effective or completely not effective. It kind of depends. So in 4 to 13% of people in studies, they did develop antibodies. Doesn't mean the drug won't work. It could be less effective. This 2% is neutralizing antibodies. If you are the 2% of folks who develop that, the drug will become ineffective. So keep that in mind. Nasopharyngitis, so that's 13% of folks. HA is headache, muscle pain can occur in up to 12% of people. And again, I want to point out the numbers on the side effects. It's just up to, okay? It doesn't mean if you take this, 12% of you are going to get muscle pain. It just means up to 12% were seen in studies to develop muscle pain. I wish I had more feedback personally. I don't know. I don't have any folks that are on Entyvio that I know of, so I can't speak to the side effects, whether those are super accurate in my experience. So just use these as rules of thumb. Because Entyvio kind of tries to attack the immune system component, we do want to watch, and your doctor will watch. They're going to be monitoring your labs, and the ones they're going to be looking at is your liver enzymes. So this would not be a good choice if you have any liver cirrhosis, anything like that going on. They're going to make sure that you don't have active TB or tuberculosis. The last one I want you to understand is very, very rare. but sometimes it's been noticed when people receive Entyvio, if they, it's very rare, but people can almost present with stroke-like symptoms. They get weakness in one side of the body. The limbs kind of get clumsy. That can be a sign of a really rare side effect with Entyvio, and if you ever notice that, or somebody notices that in you, get a hold of the doc, talk to him about it. They're going to pull you off it. Again, very, very rare, but it has happened in studies, so you need to know about that. And the last thing is, I don't know if we'd see this a lot, but the question comes up, can it be used in pregnancy? Because obviously a lot of women have Crohn's or ulcerative colitis. The bottom line is it can. It does cross the placenta, but it can be used in pregnancy. Of course, you're going to want to talk to your doctor beforehand, but I would personally, I would not want to be using this in pregnancy unless I had no other options. But studies show that it can be. So again, this is Entyvio, ulcerative colitis and Crohn's disease drug. Any question, post them in the comments. Give me a thumbs up, subscribe, let me know if the videos are helpful. And any questions, let me know in the comments. Thanks.